EuroSki, it's a European study performed in more than 800 patients. To the best of my knowledge, more than 11 countries participated to that study. Anyway, it's the largest study about CML patients where we propose to stop treatment. And at the beginning, the aim of the study was to get a high number of patients, at least to perform a good statistical analysis, to obtain some predictive factors of treatment-free remission with enough number of patients at least to perform a good statistical analysis. We say that it's a final analysis because we've already published the EuroSki, but when we published the EuroSki, the follow-up was quite short, and we analyzed only the results after 6 months of stopping treatment. And in that current study, we have at least for most of patients, we have a follow-up of 3 years, 36 months. So what we observed is we reproduce exactly the same results as we already reported at 6 months, but with a higher number of patients. And also roughly the probability to be off treatment still in major molecular response after 3 years is around 50%. So it's really reproducible, and it's also, it means that we have reached also hypothesis at the beginning, where we decided to perform the analysis with some objective in terms of a response, and we have it's not completely over, but we start the statistical analysis in terms of prognostic factors. And I will present the preliminary results, but we need to validate what we have found on another cohort of CML patients. Two things are important. I think that we have really validated at least one of the recommendations of ELN in terms of stopping treatment. In other words, it's important to be treated a long time, at least more than 5 years. And the criteria of stopping treatment, which was a deep molecular response, defined by MR4, in other words, 4 log reduction of BCR-ABL. This kind of deep molecular response have to be sustained if we go back to what we have published in the Lancet Oncology, at least 3 years to have a good criteria. Because after 6 months, we observed some molecular recurrence with kinetic, which are probably a little bit different, but definitely we have 15% of patients who exhibit or who present a molecular recurrence after 6 months. It means that it's absolutely necessary to continue to follow the patients long time after stopping treatment.